If you're in your second year, these tips will save you a lot of stress. I'm a fourth year nursing student as well as I'm a final year nursing student, and today I'm gonna be sharing with you the tips that I wish someone have told me when I was a second year in nursing university. So the first one is use active recall instead of just memorization or passive reading. So the subjects in nursing college are pretty hard, and if you're in your second year, you already know that in the first year the topics were pretty difficult. You have anatomy, pharmacology, microbiology, etc. And the second year, it won't get really any easier. It will get harder. You get used to the system a little bit, but there's a lot of hard topics. In my case, I study in nursing university in Eastern Morocco. We have more of specialties in the second year, which is pretty difficult. Also, the internship gets a bit difficult in the second year. Now, it might be a little bit different according or depending on where you are in the world, but generally the system is quite the same. So what you really want preparing for your topics and subjects is to use active recall. Active recall is basically you read the topic or you read the notebook or the PDF that you've got. Then what you do is you close that PDF, you close the notebook, you close whatever it is, and you try to actively recall it. Sometimes there's a lot of people that prefer actually explaining as if they're some sort of teachers. That also can work. Personally, I don't do it because I think it takes a lot of time. But definitely, active recall is a very good one. I'd say one of the best things that I do when it comes to active recall is with friends. I always ask them about one thing, which is what have they revised. Now, it could be just nothing, or it could be a little bit, it could be a couple things, and I always try to revise with them, even if they just have revised a little bit. Now, this is extremely important, especially if you're in second year, because it gets really hard. Now, tip number two is review or prepare for clinical case before you start internship. Now, in the first year, you got a bit of an introduction when it comes to internships, right? At least that's the case for me, and I'm pretty sure it's the same for all the nursing universities in the world. In the first year, you got a good introduction. In the second year, however, you really go deep. You start going into the specialties when it comes to emergencies, reanimation, anesthesia, everything, you name it, yeah? So the internship is quite difficult. It's one of the hardest, in my opinion. So what you really want is you get used to it. You start preparing some clinical cases before getting into the internship. Maybe asking people that are ahead of you, maybe they're already in third year, you ask them about what are the tips they give you, which services are harder, etc., etc. And it might be different from hospital to hospital, from place to place, so there is no one fixed answer for all. And this will actually become handy, especially at first, and especially if you have different types of shifts, and also if you don't choose the team that you're with. Now, the third point is don't wait until exams to ask your questions. So basically, you've got a lot of things to learn in nursing university. You've got a lot of things, you got a lot of questions, you got a lot of things you don't understand, you got a lot of things that you do understand, and a lot of the time you've got a lot of questions. Now, one mistake that you could do is you wait until the exam just gotten and you have the deadline of the exam, then you try to ask the questions. Whether you post those questions on your WhatsApp group, whether you give those questions to your friend, whether to your teacher, it doesn't really matter. But what you will notice is you will cramp up a lot of questions, a lot of knowledge that you need to learn in a very fast period of time. Trust me, with nursing college, you don't really want to do that. So what you want to do instead, you got a question, ask it instantly. That's personally how I do it. In lecture, I make sure that I'm always in the first row. So it becomes really easy to ask professor a question. I just talk normally. I don't even have to raise my voice because I'm literally next to him. And it's really easy to understand. So ask questions all of the time, and this is extremely important, especially in internship. Don't wait until the exams of internship, then you ask questions. What you want to do is ask questions in the internship when there is no exams. Okay, the fourth point that I really want to talk about is practice your communication with people. So this is one one of the most important aspects of nursing in general in nursing university, as well as when it comes to exams. This is the number one thing that you get rated on actually. I have professors, I have supervisors that all what they care about is your communication with the patients. It doesn't really matter your acts as much, it doesn't really matter if you do the specificities of your act, but really what matters the most is you have to talk with the patients. You have to establish a good communication, good diagnosis, good understanding of the patients, and that's one of the most important tasks that you do. I'll say as a quick tip, you want to always ask for their names. Make sure that it's the right patient. Sometimes it's not. And trust me, even if you think that that is rare and it doesn't really happen, but one of the colleagues that were not in my class, but one of the colleagues actually in my university have made mistakes when it comes to names of the patients. So the first question you ask is, what's your name, sir? Blah, blah, blah. If he's in a post-operation, as an example, a chirurgical service, what you really want to ask is, what is your operation? What have you done? When have you done it? What happened? Why did you do it? These are information usually they will happily supply it to you. There is some attitude sometimes, but it's really rare. Most patients are really used to nurses actually asking these questions, and what you really would understand, or you will realize quite fast actually when you ask these questions, is that your act and the process actually gets easier, as well as in the second place, the patient just trusts you more. So he trusts you more, he realized that you are someone that is here to help him, because a lot of patients are actually quite afraid of nurses. So really what you do, you are deleting that phobia from the scrubs, as we say. A lot of people, when they see the scrubs, they just get scared. They're like, oh, it's doctors, I'm afraid of a needle, whatever. Now, this is extremely important, as I said, in all types of internship, in all services. It might be a little bit harder in reanimation, where every patient is in coma, but still, if he's awake, always try to talk. Now, point number 5 is fix your weak subjects now, not later. This is one of the most important things. Fix your weak subjects now, not later. Now, let me explain. Everyone, right, especially when you're going through the second year, because you cramp up the subjects from the first year and then you are in the second year. So sometimes in the first year, a little bit, you don't care, it's a little bit neglectant, you neglect a little bit, or sometimes you just, as simple as, it's a hard topic, you don't even understood it. In the second year, what happens, is that you realize that those topics come back to you, and in fact, you need to understand them in order for you to understand the topics of the second year. So what you really want to do here is always attack it. Always attack it. When you are in a topic, let's say you study specialties, right? You study specialties and you have 1 week of a specialty. Let's say reanimation, emergency, let's say oncology. Well, that's really not a specialty that you study as a nurse, especially in first few years, except obviously if you continue your studies after. But there's also that. So whatever specialty that you have a problem in, it could be just a vast topic. It could be just physiology when it comes to anatomy, like why things do things, or pharmacology, pharmaceutics, anything really. What you really want to do is attack those topics, attack them. Just focus on them a little bit, give them more time, talk to people that are specialized in that topic, whether they are your teammates, whether they are your colleagues, maybe some professors, as well as some people just in general that's their specialty. In internship, you will find a lot of services. If you could choose those services, you'll find yourself at the end of that year, you'll find yourself having a very complete, let's say, knowledge that, let's say, will not give you a lot of problem. Now, point number 6, and here, this is a bonus tip from me, is especially in the second year, what I really want is adapt. So the first year is the biggest adaptability that you do. Obviously, you have no clue about the system, you have no clue about what you're studying, you have no clue about the subjects, the domain, the field, the medical field, you don't have no clue about the acts. In your second year is the last chance that you have here to adapt to your university. Nursing university is tough and it needs a fast adaptability, but if you haven't adapted yet in the first year, your second year is your last chance. You have to adapt, and you have to adapt the right way, and you have to adapt quickly. Now, how to adapt? Really just get used to it, understand the systems, understand what matters, understand what are the priorities, and what do you need to focus on. Now, let's do a quick recap of all the points that we have seen right now. The first one is start using active recall early. Meaning instead of passively reading, you want to close your notebook, close your PDF, and basically try to remember, because that will actually increase your memorization skills. 2, review clinical skills, especially before internship. Number 3, don't wait until exams to ask questions, ask them now, whether in internship or in theory and lectures. Number 4, is practice your communications with patients, especially before exams, and don't wait until exams because you might get screwed. And number 5, which is fix your weak subjects, which really will give you a huge advantage, especially in the upcoming years. So that was me, a fourth year nursing student and a final year nursing student as well. And these are the things that I wish I knew when I was in second year in nursing university. Type down below the biggest challenge that you have in nursing university, and I make sure I'm gonna make a video on how to fix it. Thank you.